And if you wouldn't mind just having a seat for me here. Brandy, now that Dr. Scott is sitting in the chair, let me talk about some of the benefits of this room and what makes this room different than the dual entry rooms. In the other room, we're walking in from behind the head wall, so the sight line is just a nice toe wall with artwork. Here, once you seat the patient and they're seated in a nice, comfortable chair, now you can go ahead and deploy that second tier, which houses that 90% profile. And just like in those universal rooms, this is also within reach here. Okay, so let's get Dr. Scott here into position. And we can kind of talk through some of those items, because the position of the patient, the workstation, and the doctor and the assistant are going to be critical. So Dr. Scott, I'm going to go ahead and put your chair down. And Brandy, did you want to be on the doctor's side, or would you rather be an assistant?
I can be the assistant.
Okay, let's switch sides here. And I want you to note how easily we did that. Even though we have more compact rooms in terms of our competitors, we have more usable space. So the doctor or clinician should be able to run all the way from the 12 o'clock position all the way to the 7 o'clock position. Now, the first thing that is important to note is that you need 4 feet, 48 inches from the center of the headrest here to this back wall. Okay, which I went ahead and checked, and we do. So now, once we have that number, the second critical point for a right-handed doctor, which is what we're doing here, is going to be the patient's left shoulder. So you want the Corian edge to line up with the patient's left shoulder for a right-hand GP. The assistant gets some flexibility in terms of how close they want the workstation, okay, if they wanted it closer or farther away. But you can see your consumable bin here will clear this back counter. So from there, the doctor is going to kind of dictate the positioning from that point. So it's important that they're in position. So I'm going to go ahead and line up here. It's my ideal. Dr. Scott, I'm going to raise your chair a tiny bit here, and I'm going to lift your head back. Because I want to be able to have my legs underneath the chair. And I want my knees to be about 110 degrees. I mean, really, you can go on in regards to posture here, but the workstation is going to be helpful in getting into proper position. Okay. So then the assistant flexes from where the doctor's at. What we find is the interleg lock, which is what we're doing here, where their doctor's left knee is in between your left and right knee, is going to be the most ergonomic for the assistant. Okay? And the reason being is you don't need to twerk. Go ahead and try to grab something there. Yep. And okay, versus, can you reach Dr. Scott's mouth? Perfect, okay? And why? So we need everything, all the magic to happen here. So what if we were doing two-handed? It's going to be slightly different, but we're still going to use the patient's left shoulder as a marker. And I'm actually going to have you come over to this side and be the doctor. Okay. Or hygienist, right, for a two-handed application. And now you have some flexibility. This channel here completely moves all the way around. And for a left-handed doctor, that's exactly what we would do, is push this over and move the whole unit. But a two-handed provider gets a little bit of flexibility on how they want this positioned. It can be positioned to have this edge here, or something like this.
Sounds very simple and looks very easy.
And then when you're done with the treatment, this chair here, which has the heat and massage. Dr. Scott, I'm going to go ahead and give you this. Does that help make you a little bit more comfortable?
Totally.
What do you think of the differences between just me simply giving you that remote?
So what I love about this is it gives me something to do to feel like I have a little bit of control.
Yeah.
Whereas when I just come in and I don't have any control, I feel more nervous.
Yeah. Which we're both right on top of Dr. David here, right? So you can see how any little bit can help. So we have, if we were going to be doing sedation in this room, we have the ability to go ahead and dim the lights and keep our work surface illuminated. In just a quick second, I can just dim these lights right down. And then with a wave of the hand, we are ready to get working.